My name is Malap Sandhu, and I'm a research scientist at the Shirley Ryan Ability Lab. What motivates me the most is this understanding that there is really a lack of rehabilitation interventions for people with MS, and I really want to change that. One of the interventions that our lab is interested in is this idea of acute intermittent hypoxia. We briefly limit oxygen. What happens is it triggers the release of these molecules throughout the central nervous system, which can then facilitate neuroplasticity and strengthen the connections between the central nervous system. The idea is that if we combine this intervention with traditional rehabilitation like walking training, the combination of the two would produce better outcomes than any single intervention alone. We, at the same time, have developed outcome measures using markerless motion capture to measure joint angles in people with MS while they walk. And then using this data, we can develop what is called the gait deviation index. It tells you how similar or how different your walking function is to a normal gait. And we can use this to track walking performance over time or look at the changes after they have participated in an intervention. MS is one of those conditions where no two patients are going to look alike, and we really need interventions which could be tailored to each individual and where they are in the process. It is a new area in people with MS. There is not a lot of work that is being done. We are seeing some phenomenal results, and we would really like to build on that, trying to develop something which will help improve the independence and the day-to-day activities in people with MS. I've had really the best experience working with people with MS. They are by far the most hopeful cohort of individuals. There is a general sense of wanting to improve the outcomes, not just for themselves, but for the whole MS community.